It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome, my friends, to another special edition of the Sam Lesante Show. Folks, so you're 60 years old or you're older. Why is this show so important for you to listen to and to tell your friends and go to our website? It's about a VitalChoice partnership, and it's exciting. It really is exciting, and brought to you by Lehigh Valley Hospital, Hazleton. We're going to talk to a few people today, and they're going to tell you all about this exciting, I'm telling you, I think it's fabulous. Now, the manager of this VitalChoice program is Lisa Marie Halecky, no stranger to our station, nor to the area. Lisa, how are you?
Great, Sam. How are you?
Now, this is something that's really, give me the history of this senior choice program.
It's a great story.
It is.
So, 1992, a program starts at St. Joe's Hospital. Joan Warner and Bernadette start this program with a small group of 55 plus at the time, and they have a breakfast and they give them kind of some information about health and well-being and everything like that. So, you know, fast forward now, this program has grown to hundreds and hundreds of members over the years. And what they do and how they put their program together is they have lunch and learns every month. They get together, over 200 people, members of the program. They get some information. It could be providers from Lehigh Valley. It's also other outside sources, such as maybe the Attorney General's office with great information. But every month they come together. They have picnics, they go on trips, and it has become a great social outlet for a lot of our elders in our community. And as you know, Sam, I don't know how you feel, but I'm getting closer to that 60 mark, and the name senior just isn't really, you know, cutting it for me right now.
I'm 55, so I don't get it.
Exactly.
Yeah,
so
okay.
you kind of know what I'm saying.
Yeah.
So we decided to take that already robust program with hundreds of members and enhance it. They've already had the benefits of all of the wonderful medical services, wellness services, and fitness services that Lehigh Valley Health Network has to offer, but we really never packaged it as one program. So unfortunately, COVID came into play this past year, which hindered us getting together and having all these great social programs. So while we had that little bit of time, we decided, let's look at it and let's enhance it and let's bring it up to the future. And hence the word VitalChoice came in. And what we did is we integrated all these wonderful services together to create this program. So those who are already in the Senior Choice program, they're already vetted right into VitalChoice, and we of course are accepting new members.
I want to get involved with this.
Okay.
What do I do?
Well, you have a couple choices. If you are computer savvy, you can go on our lvh.org/VitalChoice website, our webpage, and you can sign up virtually that way. You will get a welcome email back. You will be put into the program, and as we have different things going on, we'll be doing some virtual programming coming up in the next couple months because unfortunately we can't get together. Once we can get together, there's going to be some more wonderful programming going on, walking with a doctor, maybe some 101 learning how to use a smartphone for those who aren't already savvy with that. So there are a lot of different things we're looking at doing to get our VitalChoice members back together again when we can. And another way that they can call is the 570-501-7444. And either myself or one of my other representatives for VitalChoice, Robin, will answer any questions that they have and get them signed up for the program. It's easy as that.
It's amazing how this hospital, Lehigh Valley Hospital, Hazleton, there's always interesting things happening for the community. I think this is a great program.
Well, thank you, and we're very happy to bring it to our community.
And coming up on the show, my friends, we have the host of It's Your Health, Phil Benyo, and we have Joe Stanavage, and we have Christine Valente. They'll talk about different parts of this particular program. Exciting. Always great things happening at Lehigh Valley Hospital, Hazleton. We'll be back right after this. Welcome back to the special edition of the Sam Lesante Show, folks, bringing you vital information. And speaking of vital information, we're talking about this VitalChoice. If you're 60 years old or older, this is something you definitely want to get involved with. It's brought to you by Lehigh Valley Hospital in Hazleton. Now we're going to talk to a person who's a little shy in front of a camera. He's been on It's Your Health along with his both sons, doing a fabulous job. Philip Benyo, you've been around how many years? 40 years, Phil.
It's a privilege to be with you, Sam, and help your ratings. But nevertheless, yeah, this is my 40th year of returning to my hometown and practicing medicine. And you know, it's really interesting because when we first came to town, we were looking at patients, we were diagnosing them, we were treating them, because that's how we were trained. And what Lehigh Valley Health Network has done now is they've allowed us to pivot. We're more into preventive medications and wellness. And that's just a whole new venue because we'd rather get you well than deal with the sickness later on.
One of the things that you've been excellent with, and a lot of doctors, is establishing a rapport with your patients, okay? And boy, patience in two ways: a patient and having patience, okay? I think you got to have vaccinations. The patients have vaccination. How does that work with this particular program?
Right. Well, what we're looking at is the normal aging process. What happens as we age, and some people do not age gracefully, you have motility issues, you have trouble with walking, you have arthritic issues. You throw into that some sensory problems, problems with vision and problems with hearing. Add on to that, you then develop cognitive problems. You may have trouble remembering things. Throw into that polypharmacy. 1/3 of our patients out there are on 5 or more medications, which leads to drug side effects and drug interactions. And then you have competing illnesses, heart disease, lung disease, diabetes. All these pile up and weigh the patient down. And this preventative wellness program is designed to target patients and help them handle things like motility problems. You know, 1/3 of people over the age of 65 are going to fall this year. Once you fall, it's game and life changing. You can then spiral down into more debility and more falls. In fact, in our chapter in geriatric books, we talk about the risk of falling. So what happens if you're concerned about falling? Well, guess what? You're going to sit down and use the channel changer and not get up, which is going to lead to more debility and more falls. And again, this wellness program is designed to intervene and prevent that from happening.
So you're talking about activity. You're talking about getting involved and moving around and stuff like that. So if you're 60 years old and older, this particular VitalChoice, and I like the word VitalChoice, is important for those seniors to get involved, as Lisa was talking about.
We're talking about physically, emotionally, psychologically. A lot of our patients, of course, are socially isolated. These are very depressive times. People have what I call COVID fatigue. We're not supposed to live with masks on. This is not normal. And again, if you don't use it, you lose it. And you're going to hear later on through physical therapy and nutrition how we can lift the boat up.
Okay, so there's parts to this, okay? Medical part. So what is your role then? What are the doctor's roles in?
Well, part of the issue that we like to think we play is like the center of a wheel. And today, patients are seen by multiple specialists who throw in their own treatment plans, and patients can get very lost in the shuffle.
Yes.
So we're like to think of us as the center of the wheel, the quarterback, helping to coordinate the care. And so you're going to still keep your regular physician, and if anything, this physician is going to be helped by keeping the patient out of trouble.
What are some of the concerns you have as a geriatric doctor? What are some of the concerns you have with seniors right now, okay, and why they should really get involved with this program?
Right. Well, what we want to do, Sam, is we want to be able to maximize their independence. We want to continue their ability to function because quality of life issues matter. And we're all staring at, we don't want to end up in a nursing home. This program will help you avoid a nursing home.
If you have a condition, let's assume, that's not for me because I have high blood pressure, or I have arthritis, or I have diabetes, or I have these, things that are affecting me in my life, so I really can't get involved with this group. What do you say to those people that think that they can't?
You have to, because inevitably you're like an iceberg out there that's going to melt, and you're going to melt faster by being socially isolated, by being physically not doing what you should be doing. Again, we get into that business of if you don't use it, you're going to lose it.
We always find that the people are always hesitant, particularly even with getting the vaccine. They know it's good and they're afraid. It's always that scare factor. How do you make them feel a little bit easier?
Right. Well, it is difficult, and I think Lehigh Valley Health Network has a team approach. We have specialists and subspecialists from A to Z, and tapping into your primary health care provider, tapping into your physician staff, we have the ability and we have the playmakers, and just put us to work.
Yeah. We talk about shows like this, and the plug, It's Your Health. You've been on for over 25 years. I can't wait for that anniversary show to show up. But what you've done in bringing people want information, Phil. They can't. How many people could sit down with you for half an hour? I mean, the thousands of people. So we're hoping through this information that you're going to be able to learn something. But you highly recommend your VitalChoice program, right?
I'm going to sign up myself when I get old enough.
Yeah, when you get old enough. Well, I'm 55. I say you're keeping me in good shape. I think I was keeping. You got to last.
I think it's the alcohol, but it's okay. We
Don't
won't
worry
get
about
into
the wine. They'll
that.
never kill you. Okay.
Right.
Dr. Philip Benyo, folks. Remember, there's the VitalChoice is designed to give you true choice in your personal health and wellness journey. Coming up next is Joe Stanavage, fitness benefits. And this is part of keeping you moving and keeping you happy. So let's talk to Joe now. Well, Joe Stanavage joins us now, and he's an exercise physiologist. That's a big word, Joe.
Yes, sir.
I'm telling you, that's impressive. This program, this VitalChoice program is exciting, isn't it?
Yes.
I mean, Lisa explained it, and then Philip's talking about, so if you're 60 years old or older, you highly recommend them joining this particular program.
Well, obviously, Sam, I know you're 55, so...
I got 5 more years.
5 more years, but it's going to be a great program when you get there. Right now, we're offering it to the public, to the community. Get them to come out. Obviously, staying healthy is key. Here at the Wellness Center, we act as a team. So you might have went and saw a doc, and next thing you know, you need physical therapy. And you come to the physical therapist, they treat you, they see you, they're going to go ahead and say, fitness to continue. Here comes VitalChoice. You get it all, the whole shebang right there. You're constantly coming back to us. You're constantly coming to the fitness center. It's great communication. We're staying up with the health, obviously, the health industry. So we're obviously educating, but you're coming in, you're working out.
Yeah. Sometimes people are a little hesitant, as I mentioned, okay? Now, you can keep your own insurance company, right? And your own doctor, okay? So there's no changes here.
It's your choice.
It's your choice, okay? And so what happens now if I want to join this particular program? Will they instruct me as to what I'm supposed to do?
Yep, so you become part of the program. You call, you do, your justice on that end of it. That's the first step, obviously. I always tell people the hardest step is getting here.
Yeah.
Once you're here, the exercise physiologist, whether it be me or one of my colleagues, will help you out. We'll do a nice little assessment. We'll do some blood pressure screening. We'll do a balance testing on you. We'll do flexibility, see how mobile you are. And then we'll diagnose that. We'll see where you stand on your medical health. And see what kind of program we can set you up with.
So you're tailor-making the particular situation when the person comes in, if they have high blood pressure, or if they have whatever, you then fit them accordingly to the appropriate exercise.
Correct. And I mean, and we mentioned about, your choice. We're actually helping out by contacting your doctor of your choice to come and we're finding out what exactly you're interested in doing. It could be just monitoring your blood pressure. It could be for muscular endurance. It could be for muscular strength, cardiovascular. We have all those tools here to be able to help you overall.
All right. So now, when you talk about exercise, and you talk about, a lot of times people get intimidated. Okay, and I think that's the biggest factor. Oh, they see all these people and they're really doing the things, and I can't do that, and they get intimidated, and rightly so. Okay, so that sort of holds them back. All right. Now, what do you say to people like me, who I'm seeing my friends, and there's, oh man,
Well, I might say to you, we'll go right to the treadmill.
Yeah.
Let's start. No, we start them off slow. I mean, it's basic stuff. It is literally, a new step, which is a stepper. You come on maybe 2-3 minutes at a time. We see what you like. Maybe it's not good for you. Maybe we'll go on to the next machine. And I always get once they join this program, they're like, oh, well, how do I continue? Well, you continue by coming. If you have questions, we're there. You ask us. And our staff is wonderful. We work well together, and if it's a physical therapy question that I can't answer, we'll go over to them and ask them. Or if it's occupational therapy, maybe I need a nurse. We'll go ask those questions. They're all here.
Now, with this COVID-19 thing, everything's, it's crazy. What do you, how are you safe here now? Because I'd be nervous about coming and saying, well, I'll be with all these people, et cetera.
So we are watching, we're screening at the doors. We continue that process. We're making sure, for the most part, everyone's healthy coming in. We're doing our justice between spacing out the cardio equipment, the strength equipment, limiting the amount of people that essentially come in to a certain time, also by doing by appointments. So there is, we are following the guidelines. We're doing the best that we can. Obviously, COVID had an impact on all the businesses out there, including ours. And we're continuing to reboot and rebuild. And obviously, your health is important. So you can't stop your health.
Joe, I'll bet you could tell some great success stories. You probably see people coming in that were hesitant and they didn't, and then after a period of time, they can't wait to come here. I'm sure you could tell.
I won't name any names, but I know individuals out there that came to our parking lot and basically didn't want to get out of their car.
Yeah.
I also know individuals that they lost a family member. They were so sad and at home, they just wanted to do something. Well, they joined the fitness center. They met our staff here, they did everything, and then it was like a regular basis, that socialization. There's so many, lost a lot of weight, my blood pressure, no more medication. The stories are great, and that's what we like to hear, those stories.
And you have a good passion for this. You do a great job.
I've been doing it for 10 years now.
Yeah. Your pierogies are good too.
Oh, thank you. Appreciate it.
But no, seriously, you have to have that passion. It's always that first step, Joseph. It's always that first step where I know it's good for me. It's like when you hear the people who sell these records, and you hear the CDs, and you hear these old. I think I'll buy it. Then after the 5th time, all right, I'm going to buy it. So hopefully that they'll take your advice. But there's vital. So if I sign up, then I'm instructed as to, do I have to go to my doctor first, or what do I do?
You can go see your doctor. You can just sign up for the program. You're watching at home right now. They can go online or call that phone number, leave a voicemail.
And we have the phone number on the screen, folks.
Yeah, and we'll get back to them. Obviously, it's a great opportunity. It's the new year. Let's get it going. Yeah. Let's start it up.
Good opportunity for them to do that. So now with the exercise comes the nutrition. All right, so this is where, you're going to get some exercise. And that means I can eat more if I'm doing exercise.
Sure you write some notes.
Yeah. You're going to be a wise guy now or what?
Absolutely not.
Joe Stanavage, folks, does they all do a great job up here. We're going to take a break. We'll come back. We'll talk to Christine Valente. She's going to talk about nutrition. Stay with us. Welcome back to the special edition of the Sam Lesante Show, folks. We're talking about VitalChoice, Lehigh Valley Hospital, Hazleton. Great opportunity. Now, we had Joe Stanavage on. He was talking about fitness. 2 areas I want to cover about that. First of all, you get a membership discount, but ask about the Silver Sneakers program. Okay, that's an interesting program. Now, along with the fitness, you have to eat, and you have to know what you're eating. And we have here our nutritionist, Christine Valente. Christine, how are you?
Good. How are you?
Good. So, is your daddy behaving?
No.
Okay, that's. I'm telling you, he's a classic. He's a classic guy. I mentioned this before when Dr. Valente was on the show a number of times. And we're talking about COVID-19. I think one of the most intelligent things I've heard from anybody across the nation is when he said, we do not have a book on this, and every chapter is new, and that's why things change so much, you know. So you're a nutritionist.
I am.
What does a nutritionist do?
So I'm a registered dietitian here at the Wellness Center. So I see patients in the outpatient setting, anywhere from toddlers to seniors, and I treat chronic conditions with medical nutrition therapy, or I speak with people just who want to eat a little bit healthier. I see the full spectrum of patients.
How do I know if I need you?
I think everybody can benefit from a nutrition consult. Even people who think they're eating healthy may find that once we start talking a little bit, start doing a little digging, there's places for improvement.
So you'll do a nutritional evaluation. All right, give me an example of how that works. So I come in, what do you do?
So you come in, most of the patients that I see come in with a referral from their physician.
Do I need a referral?
Usually yes, but with the Vital Choices program, you don't.
So if I join the Vital Choice program, I don't need this, okay, so,
right.
All right.
You get to come see me for a short little evaluation. It's not going to be as in-depth as a full evaluation would be if you had a referral. So we can evaluate that when you get here. We can do an introductory visit where I get to understand your needs, your history, what your goals are, and if we need to go further, then I will ask for a referral, and then we can continue with more nutrition visits.
Well, give me an example of what this preliminary evaluation is. So I'm sitting in front of you and say, in their program, Christine, what do you have to tell me?
So I'm going to ask you what your goals are. Obviously, you joined this program, right, because you were concerned about your health and you wanted to better yourself. So I want to know what your goals are, so then I know how I can help you get there.
Well, my goal is to stay healthy.
Right. So then I'll ask, what are your normal eating habits like? You know, what kind of pattern do you have? What do you like to eat? And then go from there. What kind of changes?
And you can't lie. You have to tell the truth.
You have to tell the truth.
So if you like lasagna in the morning for breakfast, you better say.
You need to tell me.
You got to tell you.
I need to know what you like.
Okay. So, but what if I say to you, well, Christine, what do you recommend for a senior? You know, I mean, should I, you know, are there things that are really, what are things that are really bad for you? What are things that are really good for you? I mean, can you help me out in those areas?
I can, and that truly depends on the individual, because it may be a more simple answer for one person who is just trying to improve their diet, and it may be more complicated for someone with a chronic condition who needs specialized nutrition recommendations.
And that's what I was getting to. Sometimes people have some certain conditions, or they're diabetics or whatever, and so you have to understand what that's all about. So you could help me in those evaluations.
Yes.
So the thing is to be truthful too. Because if I need to be truthful to you and tell you what I'm eating, because this, if you have a condition, you say, well, Sam, you know, you have this condition, this could be affecting this. Is that correct?
That's correct.
Okay. All right. So you said you're going to only be a part of this, that you will not do a full depth. What's a full in-depth evaluation?
So full evaluation, we have more time. I take a lot of time to really get to know you, your medical history. I'll check any lab work that I have access to, any lab values or physician's notes, also if I have them available to me to read. And then I'll really, again, discuss goals, what you want to achieve, what you want, and then we can come together and create a plan that is best for you, meets your needs, treats any conditions you might have, and then you also get follow-up appointments with me to continue to progress and to stay accountable. And that's why, you know, coming in for visits and discussing this further is definitely key.
And I think that's very important, because you just give people, as Phil said, Dr. Benyo, a better quality of life. Okay, so folks, you can see this particular program. It covers the wellness, it covers your medical, it covers your lifestyle, your social event. It's just one heck of a program, you know. And it's called Vital Choice, and you can keep your own doctor, keep your own insurance. It's your choice. The phone number is on the screen. Give it a shot. I think you'll be very pleased with it. Now we're going to go back to Lisa. Back again with us is Lisa Marie. So Lisa, give us a wrap-up of what we already discussed. Exciting things with your Dr. Benyo, Stanavage, and also Christine. Some additional wellness benefits, the enrollment, future information, so we give us a wrap-up.
Well, you know, you heard so many great things from all three of them, but you know, the main thing is we want all of our members to feel the best that they can feel. So the additional wellness benefits would be like an annual wellness assessment where they can come in and they can have blood pressure taken and all their vitals and different things like that, in addition to everything else that you just heard. The main thing is to make sure, like I said, that their health and well-being is met, and their social aspect, that they feel good.
It all works out good.
It all comes together.
And
yeah.
the number is on the screen, website's on the screen, my friends. Hope you learned something on this other special edition, bringing you as much information as possible to keep you healthy. We'll see you next time.